Shortly after your scheduling is completed, you'll get a call from someone from the Department of Anesthesia, either myself or Dr. Harwood. We will take a complete medical history from you, as well as integrating it with any information you have given us, given the nurses or given the scheduling people to date. With this information, we will plan a safe, comfortable, and hopefully pleasant experience for you for your surgery.
After you arrive at Chapel Hill Surgery Center, you'll be escorted to the preoperative area to be ready for surgery. At that point, you will change from your clothing into a surgery gown, and shortly after that, an intravenous line will be placed either into your hand or forearm during the preoperative process. In addition to that, before surgery, you'll be given a combination of medications, most of which are meant to provide some pain relief for after surgery. Also, at that point, you may be given some anti-nausea medicine if you have a history of nausea. When it comes time for the actual surgical procedure, we'll escort you back to the operating room. At that point, you'll be placed comfortably on the OR table and positioned so that your arms and legs are comfortable. During this time, we place monitors on to monitor your vital signs during surgery, including your heart rate, blood pressure, and oxygen levels. During this time, we generally give you a little bit of intravenous medication to help sedate you, help you relax while we're getting things ready. At that point, after everything looks good, we'll just have you breathe some oxygen through a mask for about 1 to 2 minutes. And shortly after that, give you a larger dose of intravenous medication to put you off all the way to sleep. At that point, you won't remember what's going on until after surgery. During this process, after you're asleep, we generally place a breathing airway in, and you will breathe the anesthesia gas through that, and that's what keeps you asleep during surgery. Generally, surgery takes about an hour. Including prep time, you'll be in the room about 1 hour and 20 minutes, hour and a half maybe, and that includes some wake-up time too. At the end of surgery, as you begin to get your reflexes back, we take out that breathing airway. You won't know that's there. Then we go to recovery room, and you'll be talking to us, but you may not remember much for the first few minutes. After that, you'll start to know what's going on again, and your responsible adult will be brought back into the recovery room to be there while you wake up. Generally, within 30 to 45 minutes, you're awake enough to be escorted to the bathroom, where you'll be asked to try to use the toilet if you can and change clothes. At that point, if everything is stable, then we'll take you to the recliner back in the second stage of recovery, where we'll watch you for any signs of discomfort, any signs of nausea, or any other problems. We generally want to make sure you're not having nausea before you leave and make sure your pain's under control. So both of those will be achieved before you're discharged from our unit. Generally, this takes less than 90 minutes, although in some cases it can take a little bit longer. At that point, you'll be taken back to the hotel, and you'll be provided with a phone list to call if you have any questions or problems that arise after your discharge from here.